Welcome to Close Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Jim Masters. On each edition of our show, we introduce you to some of the most innovative business leaders in the country today. You'll discover what their products, services, technologies, and business models can do for you, what they're doing to change our world and change the way we do business.
It's an established fact that one's appearance can have a major impact on their life in both their personal relationships as well as on the job. It is what has caused so many people to consider cosmetic surgery. And what is really exciting is that in recent years, the development of new surgical techniques has turned cosmetic surgery that at one time required a full hospital stay, a lengthy recuperative period, and great expense, into nowadays what is often just a simple outpatient rejuvenation procedure. For over 20 years, Dr. Julian Henley here at New Haven's Aesthetic Plastic Surgery Center has stood at the forefront of this exciting revolution. His impeccable reputation has attracted clients from all over the country for the procedures he performs. But in addition, he has served a pioneering role in the development of new surgical procedures and techniques designed to improve the results and expand the possibilities. His is truly an amazing story. Doctor, describe your practice for me.
I practiced for many years in facial plastic surgery. I'm board certified in ENT and cosmetic surgery. A good portion of medicine is almost like a template. This is the illness, this is the appropriate treatment. In plastic and cosmetic surgery, you get the opportunity to design the operation to make it suitable for the specific patient.
One of these new techniques you call the orbital lift. Describe that for me, and who really is it designed to benefit?
It is intended to bring a certain harmony to the final effect. You can get a benefit around the jowl, but this portion of the face remains as it was. By now combining the classical operation with the new techniques on the periorbital lift, we're getting a much more youthful, rejuvenated appearance. We're also using some new collagen-based biomaterials that are impregnated with growth factors, and that's an exciting area of development. It's almost a form of bioengineering in a facial structure.
Are they kind of like fillers that you use?
The classical fillers are non-invasive, and they're used with a syringe to restructure certain deficits or hollows. This is during surgery. It is used as a wall, a buttress wall, that helps restructure, remodel tissues in their new locations. This young lady came and wanted to do something about her nose. I was more disturbed by the gummy show when she's smiling. I felt that aesthetically this was distracting from her overall appearance. So when I corrected the nose, I was also able to do this new operation I developed to drop the position of the lip and keep the lip from riding up on the gums. Here's another example of that operation. I reattached the muscles to a lower location and kept those muscles from riding up the lip.
I think what I've noticed in traveling with Dr. Henley to different meetings and gatherings is that what seems to keep him going through the years is not just the development of the science and the technology, which he loves. He loves getting in there and really creatively making differences in the field of cosmetic surgery. But what he also loves is connecting with real people. And over the years, he has developed his practice and given the title of his practice, Real People, Real Results. Cosmetic surgery is for the bus driver, it's for the police officer, it's for the school teacher, it's for the mom, it's for anybody, and having those stories is what really keeps them going.
I was one of the initial developers of the computer simulation technology. We were doing a simulation to show the patient what can realistically be expected. And that was a really great communication tool between the doctor and the patient, because you can give the patient a sense of what you consider aesthetically balanced, and the patient has the means of saying a little bit more here or a little this. I then get to see the patient's preference visually. When we introduced that technology at a medical meeting, a lot of doctors raised the question, well, isn't it dangerous? Are you representing something, or is this a warranty of the result? I believe that if a surgeon is confident in his ability to achieve a certain result, he can qualify it to the patient and says, look, in my experience, I feel with 90% confident that I can achieve this or better.
Most salient feature of Dr. Henley's work is that the outcome is natural. That you look like yourself, except 10 years younger, 15 years younger, 20 years younger, but you do look like yourself. You don't look like somebody else. The features are not distorted, not strange. You don't look dumb. You look like yourself, exactly like yourself, except a decade younger.
How important would you say your artistic talent is in what you do?
I feel that the spatial sense and the three-dimensional sense is quite important in surgery. This sense of proportion. I would say that if the nose is too small, I feel it in my gut. It's just not in proportion with the forehead and the chin. The best ones should never look done. They should be fitting the patient's other features and ethnicity, look better, but the kind of response I want from the patient's mother is, gee, you look great, you changed your hair, and even the family member may not pick up the fact that a feature has been changed.
Doctor, I know another one of these techniques has an interesting name. It's called the waddle neck suspension. What is that?
This was a development I was involved a number of years ago, and it was a result of the fact that in the aging process there's a weakness in the neck and loosening of the tissue. The classical facelift uses the skin to tighten from behind the neck and up front, and skin is elastic, so over time the skin will loosen again, and one of the frustrating parts has been that after a few more years the patient says, well, you know, the other parts look better, but this part is still, I still get this little waddle. So a number of surgeons, including myself, have struggled with what is the best supportive structure, and we've now developed the waddle neck suspension, where I use an internal suspension to tie the platysma muscle. These are these muscles. We cross them over and suspend them in a contralateral direction. So it has both a static and an elastic component, and that's used together with a classical facelift. It gives us a long-lasting rejuvenation and recontouring of the neck.
Dr. Henley is board certified in two areas, otolaryngology, which is ENT, and cosmetic surgery. It is very important that when you're considering cosmetic surgery or any type of surgery that you see a board-certified surgeon. He knows the inner workings as well as the cosmetic aspect of it. On the cosmetic side, he's an artist when it comes to doing surgery. He can see the outcome before he even does the surgery. And hundreds of patients have been more than satisfied with the procedures that they had done by Dr. Henley.
In the morning, I was watching an advertisement, Dr. Henley, and I saw the results before and after and decided that, I wanted to take it to the next level and give him a call and see what he has to offer. So I was offered a consultation. We sat, we went over it, we looked at the simulation before and after. I was very impressed with that. So I decided to schedule the surgery, and we went over the surgery and the procedure. He was there for me before the procedure and after the procedure. And as I look at the ultimate results, I'm very pleased with the remarkable results that I have today. It's made me more confident in my abilities, and made me more confident in my, not only from a professional standpoint, but also on a personal level. And I'm very, very pleased with the outcome and the results.
What happens in our field is that sometimes new technology is driven by marketing rather than by experience. So sometimes a new laser comes up and it makes the television, and a patient comes and says, oh, I want this new laser. And what I really want to caution is that it's not the technology that determines the results, it's the judgment of who's behind the technology. So I still feel that the judgment and the sense of aesthetic balance behind the doctor is more important than what paintbrush you're going to use to paint the painting.
It's so often when you have some kind of surgery, it's hard and it's scary, and of course all those things are in place. And often you go have surgery to make something better that was broken before, hurting before, and with cosmetics you actually look different, you look better, and it's something that's very obvious to the patient, even if it's subtle to everyone else. And what I've noticed the most is that patients love the fact that other people don't know what happened, that they can't tell what was done. They'll just say, you look great, you look like so rested, did you go on vacation? And I think that is what patients will come back and say was their real example that they had great work done.
And there you are, the story of Dr. Julian Henley and his Aesthetic Plastic Surgery Center, a unique practice involving artistic talent, science, good judgment, and technology. I'm Doug Llewellyn reporting from New Haven.
That concludes this edition of Close Up on America's Business. If you'd like more information about any of the companies featured on today's show, please visit our website at closeuptvnews.com. I'm Jim Masters. Thanks for joining us, and we'll see you next time.